Hello, my name's Heather Horton. I am the Acting Director of Student Health and Wellbeing here at Colorado College, and I'm excited that you've joined me to talk about navigating health and healthcare, because these are important topics for us. To give you a sense of what I'm going to talk about with you today, first we're going to start with the kind of proactive part. I'm going to introduce you to the way that we approach well-being here at Colorado College from a holistic perspective. I'll share some proactive strategies for staying healthy and well, and introduce you to some of the campus resources. And then we'll switch gears and talk about navigating healthcare. And in that section, I'll talk with you a little bit about different types of providers that you might work with, the monetary costs and how to navigate insurance, and then finish up with being your own healthcare advocate. So we'll go ahead and get started. At CC, we approach well-being from a holistic perspective. Oftentimes in US culture, we're sort of coached or pushed into approaching our lives in a fairly compartmentalized way. And so for instance, if I'm really busy or stressed at work, I might be spending a lot of my time and energy on my intellectual domain and not really paying as much attention to how that stress might be affecting me in the emotional domain, or how working long hours might be impacting my relationships. And so we really try to work with students to think about the interconnections between those different domains of well-being, and to help us try to live more integrated lives within the context of a healthy, engaged, and inclusive community. Because we really recognize that it is impossible to be a healthy, well individual person if we're living in a sick community. And so we do a lot of the work that we do in the Wellness Resource Center is focused on that community aspect and trying to create a healthy, inclusive, engaged community. We don't have time today to really spend time on every single one of those domains and kind of thinking about where we might be able to do some things in a proactive way. But there are some things that I would like to emphasize. Certainly in terms of our physical selves, it's really important to try to exercise on a regular basis, eat a well-rounded, balanced diet, and to prioritize sleep, because we live in these vessels, our bodies, and we need to take care of them in those kinds of ways. Certainly encourage everybody to be up on their vaccines. I'm sure all of us are hoping fervently for a COVID-19 vaccine to be developed so that the disruption to our lives can maybe end if we can get that vaccine going. And related to that, even before COVID, it was really important for us to engage in consistent hand washing. It's one of the best ways to avoid getting colds and flu and a variety of other things. Certainly in this world that we're living in right now, masks are an important part of physical self-care and community care. And we'll talk in a few minutes about choices around substances as well. In the sociocultural domain, it's really important. We are social creatures, and human beings need to have social contexts. And so as you're entering CC, being mindful of the social supports that have served you well in your time up till now, and trying to maintain connection to those as much as you can, while building new social supports here at CC. And again, that focus on living in a community and contributing to a community that is equitable, inclusive, and in which we all do our own work to be anti-racist so that everyone in our community can be healthy and well. From an emotional standpoint, one of the things, again, that we do a lot in our office is to work with people on building some skills around recognizing signs of stress and being responsive to those by developing a new repertoire or many tools for a toolbox of stress management, and really self-care, taking care of ourselves, engaging in joy, engaging in things that feed our souls, our spirits. Time management is something that many of you may have worked on as you were going through high school, and it becomes even more important in college. So really thinking about how you spend your time, when are the best times for you to do homework, and when are the best times to socialize, and how do you really budget that time well. And then whether you consider yourself to be a spiritual or religious person or not, that spiritual domain of feeling connected to things that are beyond yourself, to a sense of meaning and purpose, is an important component of staying well and healthy. And at CC, we really try to think about how there are many different places where students connect with supports for mental well-being. And this diagram can be useful to us as we sort of think about the different moments in our lives and which kinds of resources are going to be most helpful to us in those different moments. For all of us, for instance, at any point in time, we should be trying to regularly practice self-care, and that might be things like mindfulness, prayer, meditation, exercise, good nutrition, prioritizing sleep, spending time getting to know ourselves. What are my strengths? What are the areas that I would like to work on more? And again, connecting with a sense of joy, a sense of purpose. Those things are part of what we should all be doing on a really regular basis, not putting that off until we feel like we, have more time to do that, but building that into our routines of daily practice. Again, that social support piece is really important, trying to maintain connections to the social supports and communities that you have, and then coming into this unique environment of CC, unique in so many ways typically, and then certainly unique for us right now in this time of COVID. It's going to be important for you to be really intentional about trying to connect with communities, whether that's through student organizations, affinity communities, offices like the Butler Center, your residential experience, spiritual life communities, outdoor education communities, or through things like arts and crafts or music or something like that. Connecting with the broader Colorado Springs community through the Collaborative for Community Engagement. I do always encourage students to try to step outside of the CC bubble. And there, even in these times of social distance, there will be ways for you to be able to engage with that broader community as well. Developing our skills is something that, particularly at a liberal arts institution like CC, we really value being lifelong learners, and to always know that it's okay to not know everything or know how to do everything or to manage everything perfectly, that we're all learning. I certainly know that for myself, the coping strategies that worked well for me before I was in quarantine maybe haven't worked as well for me in quarantine, and I've needed to develop new skills and new strategies, or to pull some old tools out of the toolbox. And that's the way that life works, right? There's no moment that's exactly like the one that came before it. And so we can constantly be developing those skills. And there are a wealth of opportunities and ways to do that at CC through workshops, through a variety of different offices like the Wellness Resource Center, accessibility resources, the Sexual Assault Response Coordinator, chaplains, the Butler Center. Also, there are student groups that where peers facilitate learning. For instance, we have a group of students in the Wellness Resource Center, our peer health educators or PEEPs, and groups like NAMI on Campus, which is a mental health focused group, or START and SOS, which are focused on sexual health and equity, and also academic supports. So lots and lots of ways for you to engage and continue to develop your skills. As we all will have struggles at different points in time and challenges to our coping, there are also a lot of different resources on campus to be able to access support, to be able to talk through things with someone, whether that's an advisor in the advising hub or consultation with the Butler Center or the Wellness Resource Center or the chaplains. There are also different groups that are designed to help folks struggling through perhaps different life experiences. So in our office, we offer some groups like Dating After Abuse or a grief group. There are also Smart Recovery groups run out of the Counseling Center, and we've had the privilege of having Alcoholics Anonymous and Narcotics Anonymous and Al-Anon on campus over the last few years. There are also CC peer-led groups that help students to navigate through those kinds of challenging life circumstances. And there are also some online tools that you can find through the Wellness Resource Center website. As we each will have times in our lives where we need more help and support, the CC campus also has lots of resources for that. Certainly, the Counseling Center is one of those places where people can go for support, whether that's creating a care plan, getting group therapy, individual therapy, maybe medication management or trying out medication through the psychiatrist at the Counseling Center. And then also supports that are offered through accessibility resources for disability-related accommodations. Any of those resources, as well as the Wellness Resource Center, Sexual Assault Response Coordinator, Chaplain, Butler Center, can help people find providers in the community if you need referrals for more intensive, specialized, or long-term treatment. And we also have a number of 24/7 resources on the CC campus. Our campus safety office is always a great place to go because they're on campus and available 24/7, and they can help connect you to resources that you might need. There's always a counselor on call, and there's also a service that we utilize where you can call the Counseling Center number and just dial 2 and be connected with a licensed mental health provider. There are local suicide hotlines, and our campus sexual assault response coordinator has a 24/7 advocate on call as well. So that's just a sort of snapshot or sneak peek at a lot of the resources and strategies that I would really encourage you to make use of while you're here at CC. I really do want to emphasize that prioritizing sleep is really important for your well-being. In particular, sleep does a variety of things for us. It restores our bodies, certainly, but it also restores our minds. And in particular, REM sleep, or rapid eye movement sleep, which occurs about 5 times a night, and we have more REM sleep, both in frequency and duration, as we move toward our morning wake up. And thinking, cognitive work, actually creates toxins that have to be cleaned out of the brain, and that happens during REM sleep. Memory also gets consolidated and integrated with old information during REM sleep. And so this is an incredibly important thing to prioritize, which many of us in the US don't do on a regular basis. So again, encourage you to really think about how you're going to do that when you come to school. Some good sleep tips are to avoid stimulants like caffeine and nicotine, to think about your sleep environment, make sure that it's a good temperature, not too hot or too cold, that it's quiet, dark, and relaxing. And your bed should really be your bastion of sleep. There should only be 2 things that you do in bed: sleep and sex. And beyond that, if you're reading or watching a movie, your brain is an amazing machine that makes associations all the time. And so if you're reading in bed, your brain associates your bed with reading. So then you get into bed to try to go to sleep and your brain goes, oh, this is the place where I'm awake and thinking and reading. So only those 2 things in bed: sleep and sex. Trying to avoid screen time at least 2 hours before bedtime, because the blue light from our screens actually is activating. It makes our brain think that it's daytime and makes it harder to fall asleep and stay asleep. Trying to avoid too much physical activity in the couple of hours before bedtime, and trying to have a consistent wake and sleep time. I know that's hard to do, but that is the best thing to do. In terms of substances, as students are entering college, some people have already tried substances like alcohol or other drugs, and some people might be interested in experimenting. So just want to kind of put out there that to be thoughtful as you approach those decisions in your life. Make sure that they are consistent with your own values and that you go into it with your eyes open. So for instance, alcohol and marijuana both disrupt REM sleep. So we're going to have impacts on that rejuvenating, cleaning function of sleep time. And there are other health concerns associated with those substances like toxicity or overdose, long-term impacts, for instance, on the liver from alcohol use, on the lungs from smoking, and marijuana in particular disrupts neurodevelopment. And the human brain doesn't fully develop until the age of at least 25, actually closer to 30, before your frontal lobes, these big ones that have so much to do with higher cognitive functioning, fully develop. And so you want to give your brain the fullest opportunity to develop as it would naturally. So just to be thoughtful about those kinds of choices. So I'm going to switch gears and start talking about healthcare. But certainly before we do that, I want to emphasize that you can get more information on the Wellness Resource Center webpage of the CC webpage. And that if you have other questions about any of these topics, happy to talk more with you about that. So feel free to reach out to me. As a reminder, I'm going to talk about some providers, insurance, and costs associated with healthcare, and being your own best medical advocate. There are lots of different types of providers that you might utilize in terms of healthcare. There are doctors. MDs or medical doctors are usually trying to treat specific disorders or symptoms typically with medication. Doctors of osteopathic medicine, or OD or DO doctors, tend to take a more holistic approach, looking at the whole person. They may be treating with things like medications, but might also be using less traditional Western kinds of treatments. They might be using other kinds of treatments as well. Things like chiropractic or acupuncture or herbal remedies or things like that. And naturopathic physicians are doctors that are trained really in the same ways as MDs and DOs, but also get training in things like nutrition and psychology and complementary medicines. So those kinds of doctors you might be interacting with. And within the category of physician, you might have a lot of different specialists. So a dermatologist, for instance, is someone who treats the skin. A neurologist is someone who treats the brain and nervous system. Other specialists include endocrinologists, allergists, gastroenterologists, cardiologists, and psychiatrists, and there are many, many more. Physician's assistants are people who go to a number of years of schooling in medicine. They don't operate as fully independently as physicians, but for the most part are trained to be like a primary health care provider. In the category of nurses, the difference between an RN and a nurse practitioner, or NP, is that a nurse practitioner operates under the supervision of a physician, but also is able to operate more independently and provide care and treatment, whereas a nurse is usually providing specific procedures or a collection of vitals or things like that. A pharmacist is someone who has a doctoral degree in understanding the biochemistry of medicines, and so can talk to you about, for instance, if you're prescribed 2 medications, how those medications might interact with one another, talk to you about side effects, dosages, things like that. And then there are other kinds of providers like physical therapists, occupational therapists, speech therapists, nutritionists, dietitians, acupuncturists, and so on. In terms of mental health providers, there are a variety of different types of providers by training, and folks who have the most training and education in providing psychotherapy are licensed psychologists. And then you've got licensed clinical social workers, licensed professional counselors, and then you've got peer facilitated services, which are usually facilitated by someone who's had experience with the mental health challenges that you might be experiencing and is trained to facilitate groups or provide some coaching or things like that. Each of these kinds of providers is going to have a slightly different approach because of their training, but there's also an importance of fit between you and the provider, that your personality and your goals are going to be important in terms of choosing who you want to work with. All of those professionals can offer individual psychotherapy and counseling. They could do it in a more time-limited, problem-focused kind of way or more long-term. They could offer group or couples and family, and they might also offer support groups, which are less structured. In terms of insurance and the costs of healthcare, in the US, I will go ahead and say it, that our healthcare system is pretty broken. And it's a very complex system that people have to navigate. And the costs are really high in the US, much higher than in a lot of other places around the world. It's really important for you to know that you, as the patient, are ultimately responsible for the costs of your health care. So make sure that you carry your insurance card with you. Many insurance companies actually have a digital version that you can have resident on your phone, since most of us carry those around with us all the time. If your insurance changes, make sure that your provider has the most up-to-date insurance information. Insurance companies are required to give you something periodically. Usually they'll update it on a monthly basis, but something called the explanation of benefits. And usually you can access this through your electronic portal for your insurance provider, but some insurance companies are still mailing out that EOB, or explanation of benefits. And this document shows you the charges that have been made to the insurance company, the payments made by the insurance company and by you, as well as whether you have additional financial responsibilities. So that's a really good place to check to see what's been covered, what still needs to be handled, those kinds of things. Again, insurance is really confusing. So I want to give you a sort of a primer on some of the main pieces of this, and that is that you pay a premium in order to have the privilege of being covered by an insurance policy. And for instance, the student health insurance plan that Colorado College offers to our students, the premium is about $2,800 a year. And then after you pay that premium, the insurance company typically pays a percentage of the medical bill, up to a maximum out of pocket. So in other words, there'll be a max out of pocket that's listed on your insurance policy. And that might be, let's say, $5,000. And if you reach that, then they'll pay 100% of all your bills. But until you reach that max out of pocket, they're only going to pay perhaps 80% of the bill, while you're responsible for 20%. The patient is responsible for the portion of the bill that the insurance does not cover. And there are a couple other terms that I want to make sure that you know. So a deductible is what you're responsible for paying out of pocket before the insurance will pay anything. So most of us would like to have a low deductible policy, because if your deductible is $500, then you got to pay that $500 before the insurance kicks in. But if it's a couple of $1,000s and you need something, then you're going to have to pay that couple of $1,000s. So for instance, I had to get a new piece of medical equipment, an insulin pump, and that pump cost about $2,000, and I had to pay that $1,800 in order to get the pump, because my insurance didn't yet cover it because I hadn't met my deductible. Co-insurance is that 80%, 20% that I was telling you about just a moment ago, that the insurance will pay 80% of your bill, you pay 20%. And then your copay is a specified amount of money that you pay for each service. So every time I go to my primary care doctor, I pay, say, $25. There are also some limitations on insurance. So even though you've paid that, what feels like a very expensive premium, there are going to be some things that are just excluded. And insurance policies, they are required to show you what that list of exclusions is. So you can usually find that in a document of the benefits of the policy. And for instance, my insurance plan excludes anything that's not medically necessary. So let's say that I wanted to have an elective surgery for cosmetic reasons, then my insurance isn't going to pay for that. Additionally, there's what's called a pharmacy formulary. that even if a doctor prescribes you a medicine, if it's outside of the formulary, which is essentially a list of medications that the insurance company will pay for, then your insurance won't pay for it. And so most of the time, most medications are covered, but there might be certain medications that your provider is trying to give you that are called off-label. So the medicine was maybe approved by the FDA for one purpose and your provider is prescribing it for you for another purpose, then your insurance might not cover that medication. And then also, sometimes insurance policies require that you get pre-approval to see some of those specialists that I talked about before, or pre-approval for certain kinds of procedures and tests. So your insurance card actually has a lot of information on it that can be useful to you. So I want to point out a couple of those things to you. When you go to the doctor, you're going to need to know your member ID, and that's unique to you, that member ID. Sometimes you're going to need to tell them your group ID or your group number, and that is a number that applies to all of the people in a particular group. So for instance, the student health insurance plan that we offer to Colorado College students, all of the students on that policy would have the same group number, but they would have an individual member number. And then there are a whole bunch of different numbers on this card that talk about prescription benefits. So that's that RX, BIN, PC, and group. Then the card will also show you, oftentimes it'll show you what your copays are for different kinds of visits. A regular office visit to your primary care provider is on this insurance plan, $25. If you go to the ER, you have to pay $50 copay. And if you go to an urgent care instead of your primary care provider, it's $35. I do want to point out that this is just a sample insurance card. Not all insurance policies are going to have the same copays, right? You'll also see that on this card, the deductible is laid out, and the deductible points out another important piece of understanding for insurance plans is that insurance companies essentially work out agreements with providers, and they agree to pay certain amounts of money for certain things. And so if you go to an in-network provider, that's one of the providers that your insurance company works with, the costs out of your pocket are lower. So the deductible in-network is $500 that I'm responsible for. Whereas if I go to providers out of my network, the deductible is $1,000. And then you can see there's also some RX copays, and that relates to the formulary, that medication formulary that I was talking about earlier. That medications are also typically in that formulary divided into tiers, least expensive to most expensive. And you're gonna pay less money depending on which tier that medication is in. So $15 charge for a medication like penicillin that's been around for a long time and is generic. A $25 copay for a more expensive medication and a $60 copay for another medication. Now, many of you might be saying, why would I get insurance if I still have to pay all of this money? And so I want to give you an example that, for instance, on that prescription copay, I know people who have medications that if they were paying out of pocket, it would cost them $1,500 a month for that medication. And they're paying $60 a month for that med. So even though we are having to pay a lot out of pocket, healthcare in the US is expensive enough that it is worthwhile. Okay. On the back of your card, there's a lot of information that is also useful to you. This card shows you what you have to have pre-authorization for. So if you're going to have an inpatient stay, you want to make sure that your physician pre-authorizes that stay for you. And then this card has a lot of phone numbers on it that can be useful. So member services, pre-authorization if you have to have that, questions about prescription medications or other kinds of services that might be available through your insurance. So that's all a lot to take in, right? Hopefully you've gotten the sense that the healthcare system is very complex. And so it's really important for you to try to be your own medical advocate. Try to keep track of your important health information. Know your family's health information so that you can discuss those things with your provider. Go to see a doctor regularly for well-person checkups to make sure that you're maintaining your health well. It's just like changing the oil on your car. You wouldn't say, yeah, I'm not going to do that, right? Because you know eventually that oil will wear down and your engine will seize, and that'll be a really big bill. So it's much better to go and get those well-person checkups. Be prepared for your medical appointment. You could go in with a list of questions and don't let them leave the office without answering all those questions for you. If you haven't come prepared with the questions, what happens often is that you ask the ones that come to mind, and then your doctor is on a schedule and they leave the room, and then you say, oh my gosh, I didn't get that other question answered. So go in prepared. And then follow up after your appointment. If you have additional questions, doctors should have a way for you to be able to contact them and ask them more questions. I know I threw a lot of information at you in a pretty short period of time. Again, I want to remind you that you can find a lot of information, including a lot of that information about insurance, on the Wellness Resource Center website. And also feel free to reach out to me. You can see my email address right there if you'd like to discuss any more of this with me. And I hope to see you all at the many programs, workshops, and opportunities that we offer on campus for you to really be proactive and engage in your own well-being. So we're excited to meet you, and I hope to see you soon in person. Thanks a lot.